Do your hands feel stiff, swollen, or painful? You might be dealing with arthritis, and you're not alone. In today's video, we'll break down the different types of hand arthritis in simple terms and what you can do about it. Stick around to the end for helpful tips to manage symptoms. Did you know that about 1 in 4 adults in the US, which is around 58.5 million people, have some form of arthritis? And experts predict that by 2030, cases will continue to rise as more people age. Women over 50 are especially at risk. Plus, about 40% of arthritis patients report difficulty with everyday tasks like gripping objects. Arthritis is when the joints in your hand become inflamed, making it hard to do everyday things like opening a jar or writing. There are several types, and each affects your hands differently. Let's take a closer look. First up is osteoarthritis, the most common type. It happens when the protective cushion between your joints, called cartilage, wears down over time. This leads to pain, stiffness, and even bony bumps on your fingers. It usually affects people as they get older. Next is rheumatoid arthritis, or RA. This type happens when your immune system mistakenly attacks the lining of your joints, causing swelling and pain. RA usually affects both hands at the same time and can make them feel warm and puffy. Then we have psoriatic arthritis, which is linked to a skin condition called psoriasis. If you have scaly skin patches and joint pain, this might be the cause. It can make your fingers swell up like little sausages. Ever heard of gout? It's another type of arthritis caused by too much uric acid in the blood. This can create sharp crystals in the joints, leading to sudden, intense pain, often in the thumb or wrist. Gout attacks can come and go. And finally, there's lupus arthritis, which happens when your immune system attacks healthy tissues. It can make your hands feel stiff and achy, especially in the morning. So what can you do if you have hand arthritis? Here are a few tips to help you feel better and stay active. Tip number 1, exercise gently. Move your hands with gentle exercises to keep them flexible. Think of simple stretches or squeezing a soft ball. Tip number 2, use warm or cold therapy. Applying heat can relax your muscles, while ice packs can reduce swelling. Try both and see what works best for you. Tip number 3, protect your joints. Use tools like jar openers or ergonomic pens to make daily tasks easier and reduce strain on your joints. Tip number 4, eat anti-inflammatory foods. Foods like salmon, nuts, and leafy greens can help fight inflammation and ease symptoms. Hand arthritis can be tough, but understanding it is the first step to managing it. If you found this video helpful, give it a thumbs up, subscribe for more health tips, and check out our blog at healthfulhelps.com for more in-depth articles. See you next time.